We do our best to combat the signs of aging on our face, but our hands also bear the brunt of years of wear and tear. That's why plastic and reconstructive surgeon Dr. Beth Collins is offering a procedure that promises to turn back the hands of time. She's joining me now along with two of her patients who've had the procedure done, Allie Hyzak along with Connie Stone. Ladies, thank you all so much for being here.
Hi, Teresa. Thanks for having us.
So, Beth, let's talk a little bit about the hand procedures. Is this growing in popularity?
It is. So people notice that their hands give away their age. You could do
it's
everything.
True, right?
Yeah, it absolutely is. And you could do everything to your face, and then unfortunately, there are your hands, and it gives it away.
Right.
So just like the face, what's going wrong with the hands is that you lose volume. That's one problem. And another problem is sometimes we forget to put sunscreen on our hands, so you get the age spots. So by combating those two things, replacing the volume and treating the skin by making the age spots fade, we could really trick people again into thinking our hands are more youthful.
So. All right, we have some video. Actually, we're going to have you walk us through the procedure. Tell us exactly what we're looking at here. Doesn't look too complicated,
so this
right?
is Allie having her hands done, and I'm using a product called Radius, which is one of the fillers that I also use for facial rejuvenation. That was an injection, and then I just massage the product into the hand, smooth it in, and you could see it just spreading out. And the goal of it is to hide. When we get older, you could see more veins, you could see the bones and tendons. I call it like the chicken bone looking hands. And what you're doing is putting that volume in and massaging it in so you get a smoother, more full contour.
Okay.
And you'll see on the before and afters what a huge difference it makes. So that takes care of the volume problem. Neither of these ladies had problems with pigmentation, so we're not going to see that here. But with the pigmentation, we could use our products that we use on our skin again, or laser treatment to get rid of those pigment areas and really make a nice big difference.
Very good. And Allie, when you heard this was available, was this something you wanted to do immediately? Did it bother you, your hands?
Well, it didn't really bother me, but I work with my hands a lot. I show jewelry and I sell jewelry, so I'm always using my hands. So I thought, you know what, let me try it and let me see how it works. And I was very surprised and really happy.
I mean, they look great, not to mention your manicure on top of it, right?
Thank you.
And what did it feel like exactly?
You know what, it really did not feel like anything. It was painless. It just looked really strange when you get these injections put in and then you see it spreading out. But it really didn't feel like anything.
All right, and we do have some before and after pictures, so we'll put those up. That was Doctor doing the procedure, just spreading it out for us there.
The reason it doesn't hurt is because I mix the product with lidocaine, so it does have a local anesthetic in it. I think most people say that they don't feel anything at all.
Oh, that's great.
During it, yeah.
All right, so there we go, before and after. We could take a look. I mean, they didn't look terrible in the first place, but you could certainly see a difference in the after.
It really was a big difference, and that was a couple of months ago. So it really has lasted a long time.
Sure. And Connie, let's bring you into the conversation. What made you have the procedure done?
I didn't have spots, or I just had a lot of veining, very prominent veining, and I don't know, I didn't like the way they looked, so
you have that option to fix it, right?
I thought I'd try, and it was instant gratification, actually.
Wow, that's great.
We just did Connie's hands, what was it, 4 days ago?
Yeah.
So the recovery
So they're pretty new, and it was painless, and no problem.
And you're pleased?
I'm very happy, yeah.
Very good. Well, let's put up the before and afters of your hands, and we can see the difference the procedure made. There you go.
Yeah, so Connie had a little bit more.
A lot more volume in the after.
Yeah, a lot more in Connie. You could see her veins and a lot of the tendons, and so I think we made a big difference.
Absolutely, wow. And Doctor, when typically do people see volume change in their hands? Is there an age, or does it
It's hard to say. I think it's probably the same as when they're seeing changes to their face, but we're so used to doing the Botox and fillers or facelifts or surgery to the face, nobody really thinks that they can do anything for their hands. People are surprised to know that there's even something to offer.
Right.
So I love this.
Yeah, I mean, it makes a huge difference, and typically not a lot of downtime here, right?
Yeah, really not a lot. I do ask people not to be very active. Like, I had to really fight with Allie to stay out of the garden. She's an avid gardener. So that's a little bit tough, because what happens is if you do too much with your hands right after the procedure, it swells a lot more, so the recovery is not quite as comfortable. But otherwise, no downtime. Neither one really bruised. Yeah.
Not so bad. And Alex, is this something you would recommend to people?
I would. I probably would have waited a little bit for mine because it wasn't as bad as it could have been. But I think anybody can do it. It doesn't hurt, and it really does make a huge difference.
Very good. Well, let's put some information up on the screen. Of course, you could visit Dr. Beth Collins. She's located in Guilford. The number 203-689-5295, or visit BethCollinsMD.com. And you're on social media too. We'll find you around, right?
Yep.
Very good. Well, ladies, thanks for sharing your story, and Doctor, thanks for being here.
Thank you.